My name's Elizabeth Lacasia. I was diagnosed in 2007 with, actually not quite sure which stage at that point because they had a hard time defining it. I ended up having bronchoalveolar carcinoma, or as they defined at that time. I had surgery, and about a year later it came back and was spread all throughout my lungs. So I've gone through a number of different courses of treatments, including several surgeries and a number of different types of combinations of more generalized chemotherapies as well as a number of targeted therapies. I initially had a genomic testing done, and I came up as wild type. About 2 years ago, I was retested after I responded. I was being treated with Alimta and Tarceva and had about 4 years of complete response. And at that point, they retested my genomic testing, and it was more comprehensive. It wasn't just ALK or EGFR. They found out that I had ROS1. So after we found that out, obviously, I went on crizotinib. And I've been on Xalkori for over a year now, and I'm no evidence of disease, NED, at this point.
Great. Congratulations.
Thank you.
So just to introduce myself, my name is Ravi Salgia, and I'm at the City of Hope, and I'm a medical oncologist. And my specialty is really lung cancer. I do thoracic malignancies, and I've been doing this for a long time. So I was in Boston first, then Chicago, and now here in California. And so it's very lovely to hear that you're fighting this battle and you're winning. And at the end of the day, what I have to say is we all have to come together and define this. And those, who are the people who come together? Those who are the experts and also the patients. I think what we're realizing that is individually you can't solve the problem.
It has to be a collaboration.
It has to be a collaboration. But as a collaboration, we also have to fight the system, right?
Absolutely.
And what is the system? The system could very well be, can you be seen in a timely fashion in the clinic? Exactly. Is the system, can you be seen by an expert? If you can't be seen by the expert, can you do telemedicine, as an example? And if you can't do telemedicine, are there other venues? Can you do email? Can you do, I actually love FaceTime. So people can actually, a lot of people want to know what I think about certain things. We FaceTime and we look at the scans together. This technology is just absolutely brilliant. But at the same time, you have to be aware that these kinds of technologies exist. Molecular diagnostics, the therapeutics, the multidisciplinary team. But you also need to keep a good track record of how you're feeling with all these therapies. The way we figured out how patients got very fatigued or had severe nausea and vomiting is by talking to patients, but then they also kept a great log of what was going on. So what I also do in our clinics and our whole team does, and actually majority of people, is we empower our patients to keep a track of everything. And then sometimes you don't get enough time in the room, right? But then you tell the nurses what's going on, and the nurses come back and say, this is very funny. Why is Elizabeth having this, or why is Elizabeth having that? So it's really that team approach, and we're part of your team, right? So that means your physician, your nurse practitioner, your PA, your nurses, your CRAs, and so forth. But then everybody pays attention. But I think if we all paid attention, we can do less toxicity.
Right.
Or manage toxicity.
And I think as a patient, too, I think the patient also has a role there, because I'm now more aware of what works for my body. For instance, you talked about fatigue, and when I was on the Alimta that we were doing the B12 shots, I continue to have the B12 shots to this day because even though my B levels are within the normal range, I definitely notice a difference that they help me. And about every quarter, when my tail feathers are dragging a bit, I get the B12 shot, and it works beautifully. So it helps me. It may work for some people and not others, but I can also help my medical team by sharing with them of trying things. I'll try this and that, and say, you know what, consistently these things seem to work. And there have been a number of times that I've gone into the nurse practitioner or talked to Dr. Gandera and said, you know, I really tried this and this seemed to work. Or when I was on Tarceva, you said, you know, I'm really surprised that your fingers, you don't really seem to have the cracking with your fingers and things like that. What are you doing? And I had a special cream that I was using that I used to use on horses' hooves, believe it or not, and it worked tremendously well. Just things like that where there can be a very mutually beneficial relationship between the patient and the doctor, because the patient is living with this every single day, day to day, and they're the ones that are having to manage the side effects, because unfortunately, as well-intentioned as the oncologist is, like you say, you may only have 15 minutes with them, and you're really focused on getting my cancer and killing my cancer, and that's what I want you to do. And I look to my pulmonologist, my GP, you know, my other specialists maybe to help me manage the side effects or the quality of my life. And then if I'm learning something there, I can kind of share it with the oncologist.
Absolutely. And then symptom management is important, palliative care is important. And so all of the healthcare providers are incredibly important. But what I also think is important is support groups, right? Where you share amongst ourselves, and to be able to say, well, I had this and this and this, and I'm on this dose, and and I tried this. And we strongly believe in that. We bring together support groups to be able to say, you know, can we talk about these issues? And nutrition is very important, right? Exercise is very important. The mind-body is incredibly important. And so how you feel about what you're doing, and are you, are you depressed? Can we think about depression? So all of these things are important to you, and it's important for us to be able to help you get through that. And a lot of times, it doesn't happen overnight. You know, nothing happens overnight except for traffic in LA. And, right? And so the big thing we worry about is their long-term toxicity, short-term toxicity. How is the person feeling? What is the quality of life? But we take, for me, I'm always worried about, you know, the molecular alterations that can occur. What is the cancer? What is the stage? But we also have great teams that we worked with together that we worry about the whole person. I think that's actually important, and I commend you for everything you're doing, and God bless you.
Thank you.